So we are excited that at Noble Cosmetic Surgery, we can now offer combination surgeries. So this patient came in and wanted her breasts to look a little bit bigger. She did not want to have the scars that are associated with a lift. And she wanted us to do a tummy tuck because she wanted to improve her midsection. And so we decided to do our signature Noble lipo-contoured abdominoplasty, where we start off with liposuction, as you can see here. Look at that gorgeous fat leaving. And then we are going to proceed to do the tummy tuck. The reason why we do liposuction first in this patient is because she wanted to augment her breasts, but didn't want the scars. She didn't want the implant. So we're going to use that fat and transfer it to her breasts. So as you see, we started off with repositioning her belly button, and now we're doing that lower incision, very low, because we want to hide it underneath her underwear, okay? And Dr. Obasi is doing this case and being assisted by Dr. Olumba, who's working on the opposite section. And at Noble Cosmetic Surgery, with these two board-certified cosmetic surgeons, we work in tandem. It's like a song and a dance. It's a symphony. We work so well together that we're able to anticipate what the other person is going to do. And so right now we're lifting that flap. You see easily the skin portion is leaving the bottom fat and the fascia intact. Now we are repairing diastasis. So diastasis is the separation of the rectus abdominis muscles, and that separates with weight gain, pregnancy, childbearing, those kind of things. And so right now you can see as we sew this in, we proceed with repairing the diastasis, pulling that rectus together, and this narrows the waist significantly. Now we have taken the excess skin out and we are reapproximating the skin that remains. And then we proceed to sewing things together. As you can see, she does have some swelling, but the excess skin is gone. The waist is narrower. And then you might be thinking to yourself, well, where did all that fat go? Are they ever going to get to it? I promise we'll get to it in a bit. And so we just continue with, this is a step-by-step process where we reapproximate the skin in 4 layers. So that helps to keep this incision nice and strong so that as we heal, we reduce the tension. This is a tension-free closure. So Dr. Obasi is working on the left side of the screen. Dr. Olumba is working on the right side of the screen. And we sort of drop some drains underneath, and the drains allow us to have prevent seroma formation, which is a collection of fluid. So we finished the abdominoplasty at this time, and we're going to go over to do the fat transfer to the breast. So like I said, the fat, we're back in, we're working on the fat. So this is how we transfer the fat to the breast. And with this patient, because she has ptosis or sagging of the breast, we're actually transferring to the top first, and we're going to transfer more fat at the top than the bottom so that we can try to help repair her ptosis. So this is done in a very sequential manner, and you can see that beautiful fat going in to the breast. So we do that in a sequential manner, going from one side to the other. And you might have noticed, but Dr. Olumba and Dr. Obasi switch spots. So Dr. Olumba is now on the left side of the screen, and she's actually gone to the other side of the screen, working on the other breast. You can tell between the two breasts, one is much fuller than the other. And this is our final product. We have fat transfer to the breast and abdominoplasty. It brings us so much joy at Noble Cosmetic Surgery that we're able to do 2 procedures at the same time, give the patient what she wants without compromising her desire not to have implants and not to have a long incision.